We're going to try to clear up the misconception that chiropractors cause strokes. To help us do that today, we have Dr. Jim Kliamovich from Kliamovich Chiropractic in the back mountain of Luzerne County. Dr. Jim, how are you today?
I'm very good. How are you today, Dave?
Pretty good, but I can't honestly say I've heard this one before, but some people used to say that chiropractors cause strokes. What was that all about?
There was a huge misconception that the chiropractic adjustment of the neck would cause a stroke. Probably came across because of the popping sound and the twisting and turning that occur with an old-fashioned manual type of adjustment to the patient's neck. What had happened is that through recent studies, and because this became such a large portion of area of concern for the malpractice, also because patients believe this, so then lawyers hopped on, and if someone did happen to have a stroke after leaving a chiropractic office, automatically it was blamed on the chiropractor. And what is found is that there is about as much chance of having a stroke when you leave a chiropractor's office as leaving your hairdresser, the grocery store, your family doctor, which is to say there is no correlation. Now, there is proper techniques in some people that could be susceptible to stroke that we do have to make sure that we are not putting them in a line that anything we do could cause that to happen in the near future. Not to say from the adjustment, but just in general. Those things we do screen for and make sure that the patient is in a safe environment.
Now, stroke is often referred to as the silent killer, so when it comes down to it, you could really have a stroke anytime, any place, irregardless of what activity you're doing.
Absolutely, absolutely. There are some things that will cause the possibility of a stroke to increase. In those patients that are susceptible, that do have plaquing, if they're engaging in extreme activities, anything that's going to increase their blood pressure dramatically, that of course is going to increase their chance for having that stroke happen. But really it is a silent killer. There is no time that it's going to happen.
And chiropractic really these days is extremely safe. It is licensed everywhere and covered by just about every insurance plan in America.
Absolutely, absolutely. There are also treatment options. Most folks and patients believe that the only type of adjustment is a manual adjustment, meaning with the doctor's hands. There are other treatments out there that are mechanical. They're very safe. They've been tried and tested and gone through rigorous FDA clearances that will perform and have the same result, but just a different mechanism. They use handheld mechanical devices. There are also very sophisticated computerized devices, like one that I do have in my office that we'll talk about at a later date. And these will do the same thing, and again, it takes that popping and clicking out and also the twisting and turning that are involved. It just mainly, it gets the same job done. It just eases the patient's mind too.
Doctor, for our viewers that would like to get in touch with you, what's the best way to reach you?
They can reach me at my website at kcopro.com or call at 477-2778.
All right, very good. Dr. Jim Kliamovich from Kliamovich Chiropractic in Sweet Valley in Shavertown. Thanks so much for being here, and we'll see you again next time.
Thanks, Dave. See you soon.
Today's social media question of the day has to do with winning the lottery. What would you do if you hit the lottery for $600 million? How would you spend that money? Tammy Louise on Facebook says, I'd be glad to have only 1% and be comfortable. Who needs all that kind of money and all its worries? And we want to know what you think about this question. Just hit us up on Facebook at PALive and tell us your answer. You can also tweet us on Twitter at Dave Kaharchik and at Britt Sween. And in our hot video today, you've heard of pie or hot dog eating contests, but what about watercress? The healthier version of competitive eating next.